Let's get more on the situation in Gaza. We're joined by Imene Trabelsi, who is the Middle East spokesperson for the International Committee of the Red Cross and is in Beirut this morning. Thanks so much for joining us. I mean, how bad is the situation in your assessment in Gaza right now?
Unfortunately, the situation is worsening by the day. Compared to yesterday, we are seeing already signs of major distress among the population. The health sector is on the verge of total collapse, and that is due to limited resources within the hospital versus an increased need in terms of the number of people who require assistance and life-saving assistance. The electricity is also causing quite a threat to the capacity of the hospital to continue their work during the upcoming hours. As of yesterday, the main central the power plant of Gaza has stopped working completely, which means that the entire population in Gaza and the institution have no longer access to electricity and have to rely on private generators in order to have electricity. But this is also problematic because there is no provision in fuel, which means that the hospitals in the upcoming hours might have even more limited capacity to operate. With no electricity, there means no functions in the hospitals, and this is quite worrying for us. A colleague of ours have been around one of the main hospitals in Gaza, a Shifa hospital, and I'm using his own words. He was saying that this hospital is likely to turn into a massive graveyard in the upcoming hours due to the fact that health staff, the facilities are no longer able to respond to the increased pressure. Overall situation for the population is quite distressing on so many levels. There is very limited access to all basic needs: water, food, shelter, and security mainly. We don't know what we have not seen this level of violence in years, and it's always, with each and every cycle of violence, it's always the civilian who pay the price of this.
And Imene, I was going to ask, I mean, do you still have medical professionals on the ground there? How many? And what is their mindset and commitment to the cause at the moment? Would they want to leave if they were able to, or are they committed despite the huge risks they're facing?
Our teams in Gaza are still on the ground because our entire team in Gaza are local, and therefore they're still in Gaza with their families, and they are living the same conditions and horrors and fear, permanent state of fear that the overall population in Gaza is currently witnessing. So, short answer to your question, yes, we still have teams who are undergoing the same circumstances that the entire population are going through, trying to find safety for their family, but at the same time trying to assist and do their work as humanitarian staff. So far, we've been working closely with the Palestinian Red Crescent and the health authorities in order to support them to respond to the increasing health needs. We donated medical equipment to both of our partners. But what we can say for sure is that what we've been able to collectively to provide as aid actors in Gaza does not actually rise up to the level of the needs that we are seeing at the moment. Further aid needs to be provided, and here I want to use this opportunity to stress on the fact that all parties to the conflict, they do have legal obligation under the international humanitarian law, which is to maintain access for the population in terms of basic needs in such circumstances, namely food, water, and health services. Today, what we're seeing in Gaza is that there is a major state of distress among population who are not able to sustain their needs. And important to flag that the communities in Gaza were already living in quite some state of vulnerability due to a pre-existent economic and social vulnerability that was caused by over almost 16 years of restrictions of movement on people and on goods.
And of course, many people are already arguing that it's a breach of international humanitarian law to cut off electricity in this way, regardless of whether it's in self-defense or not. But my question to follow up your points there is the extent to which you think it's a legitimate argument, given your experience that you have so many people there on the ground, many of them, as you're saying, are locals, to say that Hamas, in a large-scale way, hides amongst civilian population. Do you think that is a fair point that Israel makes, or is it incredibly minor if it does exist, thus such that to take action that is clearly hitting so many millions of individuals is an overstep? What's your view on that?
Let's make it clear that when we're talking about civilian high price paid by civilians, we are talking about civilians on both sides. We are today, whether that be in Gaza or in Israel, families are in a state of distress because they lost loved ones, because they don't know where their loved ones are, or because they're living under a permanent state of fear because they don't know if their house or the shelter that they're in will be struck next. So civilians on both sides, they are the one paying the price of continuous and ongoing cycles of violence. And today it's very important to stress on the fact that only political solutions can solve this continuous cycle of violence that the population have been undergoing on both sides for years. Now, it's important to establish as well the fact that, as you mentioned in your report, Gaza is a crowded area in which over 2 million people are living in a pre-established state of vulnerability. 8 out of 10 people in Gaza rely on some form of humanitarian assistance. And therefore, this creates quite a prompt base of fast deterioration of humanitarian conditions whenever such circumstances occurs. Now, what we are seeing today in Gaza, although unfortunately this is not the first time that the population in Gaza undergo or see a cycle of violence. This has been going on for years, and population on the both sides of the fences have been undergoing this situation. But the level of violence that we are seeing today, we have not seen that in years. And it's very important that all parties to the conflict, whether that be all groups involved in this conflict, that do respect their legal obligations, and that my apologies, and that also that specifically indicate that there is an obligation to respect the safety of the civilian, their access to basic needs during such circumstances, and of course respect and protect the vital infrastructure for civilians. It's important also, right now I'm going to use this opportunity to flag that aid workers and rescuers were also part of the victims of this ongoing violence. Yesterday, a total of 4 volunteers with the Palestinian Red Crescent working in front lines trying to save lives, lost their lives since the beginning of the ongoing violence. Our partner on the Israeli side, the National Society, the Megan David Adom National Society, have also lost lives during the ongoing violence. So it's civilians, it's aid workers, it's rescuers who are confronted and paying the price of the ongoing violence. And today, political steps are necessary in order to end these endless cycles.
Imene Trabelsi, thank you so much for joining us.